our clinic was shut down for 2 months, and during that time, we were trying to figure out how to shift and pivot to telehealth. And I happened to be married to an amazing lawyer, and he was looking at the laws, and he's like, in the statutes, it says that you PTs have parity in payment, whether it's telehealth or in person. And so then we got a legal opinion, and I sent that to like close to 45 insurance and got on the phone and told them and explained that no, they're going to pay us the same for telehealth as they would if in person, and sent them the legal opinion.
This episode is brought to you by PT Pintcast Media. If you've ever thought about launching a podcast or YouTube channel to grow your brand or your clinic or your business, we can help. Find out how now at ptpintcast.com or email me, jimmy@ptpintcast.com. Our guest today has been a payment chair, a chapter president, and now he's shaping policy at the state level. But his real passion, helping physical therapists grow their leadership skills through clinical excellence and operational savvy. He believes advocacy isn't optional, it's essential. And if you've ever thought clinical outcomes and business excellence can't go hand in hand, he's here to prove you wrong. Oh, and he used to coach select soccer for 7 years, aiming for the pros before pivoting to PT. Today on the show, meet Josh Farley. Emily and Sam, and tell everybody where you are. And I like this because I don't know if I've ever done an interview with someone on this show in Montana. We can see you have very much Montana all around you. You guys are outside right now.
It's a gorgeous day in Montana. So we're out of just outside of Missoula, Montana. So in the western part of the state.
I love it. So here's my initial question. How the heck did two rural Montana PTs end up in leadership and legislative advocacy? How'd that come apart? What was the spark?
Really, it kind of came unexpected because we were both own our businesses and both moms and busy, and 2020 happened. And Sam, you want to start with yours?
Well, our clinic was shut down for 2 months, and during that time, we were trying to figure out how to shift and pivot to telehealth. And I happened to be married to an amazing lawyer, and he was looking at the laws, and he's like, in the statutes, it says that you PTs have parity in payment, whether it's telehealth or in person. And so then we got a legal opinion, and I sent that to like close to 45 insurance and got on the phone and told them and explained that no, they're going to pay us the same for telehealth as they would if in person, and sent them the legal opinion. And at that point, I was not involved with APTA statewide. I was, of course, a member, but just, and after kind of my involvement there, I shared that with the APTA, and then that kind of led to myself being I was asked to be on the legislative committee, and I was like, well, sure, I'm doing that anyways, and I'd be interested. And it was really a wake-up call that we as business owners and providers have to be engaged and have to like show up and be at the table, or else we'll be on the menu. And so that was when my company and my business partners were like, let's make sure we get somebody there.
Yeah, I mean, I closed down my business in 2020. I have a compromised child at home. And so I'm sitting around for 3.5 months wondering what the heck I'm doing, where my life is going, what my business looks like. And it finally gave me the space to actually dive into the questions of physical therapy that have been kind of probably bothering me for a while. So then the next thing I know, I'm emailing off some kind of gripe letter to the president at APTA Montana chapter. And I'm like, I don't even remember what it was. The next thing I know, he's calling me. He's like, so I have a board positioning opening up in, a couple of them in the fall. Why don't you run? And I was like, well, I'll just do that. And that is how I ended up as a membership director, which, by the way, I was completely worthless at. It was not my position that was good, but it got me there. It got me active. It got me understanding the bigger and broader pictures of what is going on. And so that is how we ended up there. It was just COVID and time and space to think. And
all I heard you guys say was necessity. You were looking to solve your own problem, and if you're solving your own problem, it's probably similar to a lot more people like you in the state. I also listen. I'm not paid by APTA, but I like how a lot of people look at APTA and the big massive organization out of Alexandria or state chapters, and they do a lot of this, which you just said you did, which is fine, right? You did a lot of just some finger wagging. And what happened in both situations where they said, great, want to solve it? Let's work together. Like, it's just a bunch of people. I know there's a big building in Alexandria and it looks like Avengers headquarters, but it's just a bunch of people who want to solve the same thing. They're not gatekeeping. So, all right. So you're both sort of voluntold that you now have a position. You now have a chance to do those things. What happened next? You know, you said you weren't really good at membership, but it doesn't really... It mattered, but didn't matter because maybe you weren't good at membership, but as you just said, you were at the table now. You had a seat, at least at the APTA's table. What happened next? What was the next thing?
Well, we both realized we probably legislature session in 2021 was a train wreck. And we were both there at the seat going, oh, well, that didn't work. It was,
what do you mean? So what do you mean? What was that? What's the legislative session for people who don't know?
At one point, our lobbyist
we fired them.
She literally said, I cannot go against that dry needling thing because I have other deals working. Sorry. And we're like, but that's our only request is that you show up at this one meeting. She's like, I can't. And she ended up leaving or she was fired, whatever. But the result was that acupuncturists got to use dry needling in our state, and
got exercise too.
An exercise, which was not something we were at all wanting. So there was just a lot of fumbling, and nobody was really at the wheel when they needed to be.
And there was just little representation down in Helena in the Capitol. Our win that 2021 session was we didn't have to notarize our license on our wall, which I hadn't been doing for 14 years. So I was completely out of compliance in my own business. I'm sure Sam was too. And I'm like, wait, that was our win. And I was just like, this isn't work. You know, we both realized this isn't working. But we wanted more. But interestingly enough, because during this time, I personally on the board of directors started voting no for anything that wasn't normal motion. So I was generally causing a lot of problems. And so I got a call from Christian, who was the president at the time. And I was like, oh, I probably just got voted off the board because I'm just saying no to a bunch of things that I don't agree with, knowing that I'm supporting it once it's passing, because it's always passing, just not me. And I figured he was calling me to tell me they made a special meeting and voted me off the board or something like that. But he really actually asked, he goes, Emily, would you run as president this coming term? And I was like, excuse me? And can you get Sam to come along? And I was like, I cause problems and she even causes more problems, the legislative committee. And you want us actually at the helm here? And he's like, absolutely. So that was the first really pivotal question. I don't think I know I wouldn't have ran. I just didn't feel like I was being effective on the board. I just felt like I was pushing back. But I'm just really grateful that Christian realized that what we brought to the table was important, and to move the needle, because I know that in 2021 he wasn't happy with that legislative session and where we were going, and he just saw something different in us that we could move this forward.
Well, this is where change happens, right? There needs to be necessity, and people who, and I learned this phrase from Alan Jetty, which was positive deviance, which is I know I'm frustrating, right? Because I ask all these, I get labeled this too. I'll go into a meeting and there's 12 people on the Zoom call, and Jimmy just keeps asking big questions, number one, is this project needed? And I'm not doing it to sink the ship. I'm doing it for 3 miles down the road. We're not thinking, oh gosh, we're on the wrong ship, or the ship's in the wrong direction. So people like us, I'm feeling like this anyway, we get labeled troublemakers. That's sort of how change happens, with just good trouble.
Absolutely.
And I think PTs are so good at answering questions, asking questions. I think we are just perfect for advocacy and leadership, because we really do. We're curious. We're problem solvers. We want to figure out how to collaborate too and adapt. So I think that's part of what we brought to, just from that background.
But sometimes, and this is almost a universal truth, there's only a few, but a lot of times people undervalue the things that they're good at because they're good at them, and we overvalue the things that are foreign to us. So a PT might be, and I agree with you, really great at advocacy and legislation and leadership, but because it's foreign, we just assume these are weird words. I have no training in this, right? We're also rule followers most of the time.
I was going to say we're totally 100. We're rule followers. And we don't like to ruffle feathers or make people like, we're
Yeah.
kind of pleasers. We're like, want to get A's, want to be like good students. And I think like sometimes we give in, oftentimes I know we give in way too early. And I've like been kind of like really standing behind national and statewide. Like, we have so much value right now. We need to stop giving away our services. So like, let's finally get paid for what our worth is and not give it away.
Are you still stuck spending hours on administrative tasks? Empower EMR automates scheduling, billing, and documentation so you can actually focus on your patients, not your paperwork. Book a free demo now at empoweremr.com. Well, I need to twist the script a little bit with the next thing that I want you to talk about, which is a wild moment or unexpected moment that you've both maybe experienced during this advocacy journey. You just mentioned that PTs are rule followers, but maybe there was a point that you broke a rule and you might have gotten in deep trouble for it.
That would be Sam.
There were many.
What happened?
I think the very first one was that I was sitting in with this third party like contract person. He's the CEO of it, and he negotiates contracts for many providers across the state. And I was just looking for him as a mentor. And so I was having this conversation. I'm like, just couldn't figure out like payment wise, a certain thing. And he's like, and so I kind of said, well, why can't couldn't we do this with APTA? And I explained, and he looked at me and he said, well, do you think you look good in orange? And all I could think of was, well, orange and turquoise were my wedding colors. So how did he know that? And I said, well, I did get married in Belize. And he's like looking at me and he's like, I'm talking about jail. And I'm like, oh, he's like, you can't do that. That's illegal. And I was like, good to know. Okay. But I do think like, yeah, that was one that I remember because it made me look into some things differently. But
I don't know. I cursed more during legislative session this year than I have ever done in my entire life, I think, on multiple text messages with groups that I was like, oh, maybe I shouldn't have done that. Oh, well, whatever.
We had a group text message that we thought was just like maybe 5 or 6 of our key group. Mm-hmm. And like later, I'm like, Emily, that was like half the state there. We were talking about needing tequila. And
anyway.
It happens.
But I think it kind of brought everybody into the mix to really feel how much we were like engaged.
But I feel like what you're telling me and what I'm hearing is that it makes advocacy and legislation tangible, right? There is tension. If there wasn't tension, there wouldn't be a bill. There wouldn't be anything to advocate for. So you have to be a little bit pissed, right? This isn't just a bunch of check boxes and then things get changed. You have to have feathers ruffled. You have to have heart rates elevated. You have to have faces flush, because without a little bit of tension, no change. That's also the mark of a good story. If there's no chance for failure in a story, a book, or a movie, it's a pretty boring book. So
it's just like, think about the body. We have to challenge the body for adaptation and change so it can heal and be successful and hopefully better than when the injury occurred. And our systems are no better. Like, our government is just the same. It has to be challenged so that there can be change. It's like
no stress, no change.
Totally.
So let's break down HB 585. What is that? And how'd you push for Medicaid reimbursement above Medicare? And what does that actually mean for PTs in Montana? And also, what might it mean elsewhere?
Well, it's really an interesting story, because when Emily says she like swears and gets really frustrated with legislation, I'm the person with payment that I'm just like, when we meet with all the major payers for a couple times a year and stuff, and I just get so frustrated. So I was working with Medicaid and on a call, and there was this woman that I ended up with, and I call her like my back alley like source. I've never seen her face. I only know her first name. And she kind of has like that witness protection voice, like, you have to look at the physician's pay scale. And I was like, what? And she's like, she's like, let's get on a call. She didn't want to do over email. And so I call her, and she's like, you need to look at the physician's pay rate and how they did this bill in 2010. You guys have the same RVUs and the same conversion factor, and you bill the same. And so that was
2023.
Before 2023 for 2022. And so we were like, figured it out. And the physicians had a similar problem in 2010. And they fixed it with this conversion factor with a CPI. So every year they got an increase. And so we said, well, this is simple. We'll just model off of that. That's what this informant was telling us. So that was kind of what we went to bat with in 2023. And talk about like this plane that just did not get off at all. Our lobbyist, who was wonderful, ended up having a severe stroke in like July or August.
Yeah.
And she was out. Like there was no way she was returning. So rounding into our legislative session that starts January 1, we want this bill, but now we have no lobbyists, nobody representing us. We found somebody like in November. Was that right?
Like
it was
October, before a January session.
It just like, we just gave it all of our try we could. The whole purpose there, the whole like, I think sell was that we save healthcare dollars, and that's why we should have this. And we went in through a committee called Health and Human Services. A lot of healthcare, Medicaid goes through that. And we did get the bill sponsor, which is unheard of. We got it presented in committee. Very last minute, like 2 days before transmittal, and it got tabled. And I think there was a lot of lessons learned there, but it brought a lot of us together to like say, we can do this better. And we have a way longer takeoff strip for 2025. So as soon as that session like ended, we found a new lobbyist, and he was awesome because he didn't know anything about PT at all. Like he was just like, and he's like,
which might be good because there's no preconceived ideas, right?
Right.
But he asked such good questions that like, if you don't know about PT or you don't know about the professional world, he's just like, well, what? And his thing was like, this just doesn't even seem like it's fair business. Like you guys are subsidizing a government program. Like, this is crazy. Let's take this through Business and Labor Committee.
Yeah. He's like, it's not a healthcare problem. It's not a patient problem. It's not a health equity problem. And it's not a cost savings problem. He's like, he kept drilling in his head. It's not savings. It's not savings. Don't talk about it. You need to talk about it, the cost of business and doing business. Contractors don't get paid less in government contracts. They want government contracts because they get paid very well. But here we are, instead of like, so we modeled it directly off of 90% of the physician rate, which in normal contracting in the state of Montana, when I go to negotiate with commercial payers, 90% is what we get compared to the physician rate. But when we looked at Medicaid, we're like getting paid 63% of the rate. So we're losing $44 an hour every time we see a patient on Medicaid. So we ended up, after the first session in 2023, which died, we ended up going, we need to know our numbers better. So luckily in Montana, we figured out that 49% of PTs and PTAs work in small businesses. So we reached out to every small business we could find, and we asked for their numbers, which is really hard to convince a lot of PTs. But we told them, hey, this is who we are. This is the bill we ran. We want to run it again, but we need to know what your costs are. So give us your overhead costs based on this.
Well, we wanted the same across the board. So cost per visit, which APTA is really trying to get every PT to understand what their cost per visit is. And that is really critical. If you can understand that, then you can really understand your worth and what you need to be asking for. But so we had to like give that equation to a lot of people. And then once we did that, we kept that somewhat anonymous and then just subtracted what the fee for like the same units. So we could see across the board what was lost per visit of their cost. And we had speech and OT also because we ran it with them, just creating more, right? More numbers. And so speech was losing $68 per visit, and OT was like 51.
Yeah.
Losing
per visit. So
yeah.
And then you look at like who are the users? Go ahead.
Can I stop right now?
Yeah.
You want to move over that way, my son.
Yeah.
There you go.
So
there you go.
Could you actually go back to before you guys started your journey, before you guys, both got in these positions where you're at the table? Were you able to use words like this? Like, did you I'm trying to focus, like, look how far you came just because you cared about stuff and you're like, we're just going to figure it out and we're going to keep asking questions. You finally found a great lobbyist who was like, hey, listen, my expertise says this isn't a this is more of a this. Like, you guys are using words that I'm guessing, I don't want to assume, but you weren't using 2 years ago before all this started, right?
Yeah, I think that's true. I think
I feel like our conversations with a lot of different legislators too made our messaging change all the time. When we were sitting at a chamber of commerce event, right as the station was starting on that first day, we started talking to people. And so Sam goes, hi, I'm Sam. We're running this bill. Can I talk to you about it? And can you let me know what you think? She comes out of this just da 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 da. And they're like, wait, you're not hospitals? And we're like, no, we're not hospitals. We're small businesses. And for Montana, that resonated really well. So just having more conversations with people let us change the message that hit home. And being able to talk to different people in different ways of what meant to them. But most legislators in Montana have businesses, so they understand that in a way that connected, as opposed to the last session, as when we were just talking about access and care and they just frankly didn't care, which sucked. But I wouldn't say everybody didn't, but I would just say, as a looking at it from an economic standpoint, they just we don't really care about that.
Well, I start out saying, because most of our state is red, so these folks we were talking to, first I'm like, I'm just going to practice. Do you mind if I practice on you? And they kind of, and I said, I'm gonna throw out 2 really bad words. Medicaid reimbursement, 3 bad words, Medicaid reimbursement increase. And then you could just tell they were nervous. And I was like, I know. But before you say that, this is why I'm going to talk to you about this bill. And I want your feedback on why you made that face, because I'm going to prove to you that this matters for small businesses and why it matters, and for kiddos, because that's the biggest users for therapies in Medicaid are kiddos. So it was good just to, I'm pretty outgoing. I'll talk to anyone, and I'm really curious about people's stories. And, you just start asking them, why are you here? What's your why? Why are you, this is crazy house here. You're working from 7 to 7.
Yeah.
What's your why? Because I'm telling you mine.
Right. But when you lead with what's your why, you can then tailor your follow-up message when they eventually ask you, well, what are you doing here?
Yeah.
To pushing on the emotional drivers. If there is a relationship, right?
Yeah.
You can push on the right emotional drivers to make sure that person understands why they should pay attention and spend time with you. And I think the mistake, and I can say it because I am one, with PTs is they just keep yelling, we're PTs, we're great. All we do is want to care. And they're like, cool story, bro. Tell it again. No one cares until there's that phrase, right? It was Eleanor Roosevelt. No one cares how much you know until they know how much you care.
Right.
I love Eleanor Roosevelt. She's wrong. She's wrong. What people actually care about is, do you know enough about my problem to help me solve it? And it sounds like the world is selfish, but we sort of have to be. And your stories were sort of survival mode, right? COVID shut everything down. You had to figure this out, and you did by understanding if I can tell the right story in the right way to the right person at the right time, then I have a better chance of getting that person to want to work with me. Listen, I love a good Facebook group bitch as much as the next person, right? Everybody loves Nara and they love to bitch and gripe it doesn't do anything.
Correct.
Where you're doing it, juice versus squeeze ratio is way better. And I know it's hard. It can't be easier, right? Look how easy it is to bitch in a Facebook group. Watch this.
I know, true.
You had to learn a whole new language, a whole new process. You had to do this, I'm guessing, all on your time and your dime. Yeah. You saw the effort, and it sounds like you're getting somewhere, because not only did you do that with HB 585, you also did what? SB 109.
Correct.
Well, and actually that links together, I would say, too, is that our lobbyist, we hired him specifically for the big lift of Medicaid reimbursement. And he came to one of our legislative committee meetings, and he's like, whoa, how come we're not doing anything about work comp? And I'm like, oh, they said it can't be done. And it's a huge thing. We have to put our energy in this Medicaid. We can't afford another bill with you. And he just was like, I can't stand it when someone tells me something can't be done. Let's do it. And I was like,
Yeah.
well, okay.
And I'm like,
actually,
did he just sign us up for another bill? Okay, we're on board.
And it actually, I think in a lot of ways helped. I mean, it was a lot harder because we had 2 bills. Actually, we ended up with 8 or 4, but those 2 in particular, we got in front of so many legislators and explained PTs can order imaging in Montana.
Back it up 1 minute.
Oh, sorry.
So SB 109, for anybody who is listening that doesn't actually know what that is. So that is our workman's comp treating physician bill. So under Montana statute and law, it says these are the people who can be the treating physician for workman's comp. So who has direct access and can manage that case from top to bottom. And we noticed that there was a huge problem, and we actually did a informal study in Montana that showed it was 26 days between injury on average, throwing out all the major outliers, to getting in for first treatment in physical therapy. And based on guidelines, even in the state of Montana, it says we want them in 10 days. And we even pointed this out, and they're like, yeah. And they just looked at us like, I was like, well, we want direct access in there. We've had it since 1987 in the state of Montana. We want it now for the injured worker. Why are they different? Well, and we're like, well, just add us to the treating physician. And they're like, well, we're just not going to do that. That was a Department of Labor. We're like, we're just not going to just add you. So this was our ask.
They said they had to change statute.
We had to change statute, and we're just not going to change that statute. So we needed to change that statute. And so there was this list, which included doctors, PAs, nurse practitioners, dentists, chiropractors, and we're like, we're us on this list. So that was being born of SB 109, which our lobbyist took on because he's like, well, that just seems like an easy slam dunk win. Like,
he said,
literally,
it's just adding the letter H in physical therapist. That seems super easy.
It's 2 words onto a statute that already exists. So our treating physician is literally because it existed already, and we wanted to put our 2 letters or 2 words in there to add us on there. But that was I absolutely love that bill in testimony, because we got to stand up and own our place in this. Like, they're like, well, I don't know. These patients are complicated. Like you don't even, they have other conditions like diabetes. And I'm like, duh, I do that every day. Like, why are you making this argument? You can't even order imaging. I was like, yes, we can. You can't even do this. And so luckily what happened actually the summer of 2024 is we went to our licensing board. We got a Department of Transportation examinations in advance, and we actually got their stamp of approval for imaging that says, yeah, absolutely, it's within your scope of practice. So no changes in our scope of practice. It was just determined by our licensing board that we could do this. So that set us up right into this legislation that says, yes, we can do this. Look, our board has actually already authorized us to do this within the scope of our practice. I literally handed out, this is our scope of our practice. I also handed out this beautiful, simple study that I totally handed out, had the legislators like turn to page 4, look at the accuracy of diagnosis and MRI. And you're 82% accurate for, I'm paraphrasing off the top of my head here, 82% accurate for orthopedic surgeons, 74% accurate for physical therapists, 49% accurate for family care physicians, 25% accurate for PAs, and 10% accurate for nurse practitioners. So yes, I diagnose really, really well.
It's a great study. I think we should be singing from the tops. Bruno Steiner of the SIG for imaging brought this to us, and it was a pivotal piece to slam that down and say our clinical diagnostics, as it compares to what's actually coming out on imaging, we're rocking it. We're way above. And I think it was also, I have to back up and say, Montana has had direct access since 87, and we're a frontier state. So I call it frontier frontline or primary care frontline in the frontier. Like, people come into us all the time. Last week I had a woman that has not seen a doctor for 31 years. Wow. And she got kicked by a horse 30 years ago, and now she has this huge mass on her leg. She's coming to me because she's like, knows me and doesn't want to go into the system. But that's one of many. Like, it's so cool how much autonomy and what PTs in Montana do. We also do not have any techs. We only have licensed professionals that are working underneath us. If we want to be doctors, we need to have licensed professionals working underneath us. We cannot have these on-the-job trained, unlicensed professionals. That's not what doctors supervise. So Montana is really unique in that, and we do get to practice at the very top of our scope. It's phenomenal. It's so fun.
But yeah, I think that bill, we were in business and labor for that bill early in the session, right from the beginning. So they saw us then. They then saw us for our PTA supervision bill, because that came out of a member. That wasn't even signed on to our lobbyist. Our member came to us and was like, hey, I'd like to change that. And I looked at her, I was like, well, I need you to write a bill. I need you to find a sponsor and get it in committee. You do those 3 things, you got our backing. But we're like tapped out. And so she was the 5th person to come to me with that problem. And she was the first one 3 days later, I get a message from her, a text message, and it's a bill. She literally wrote a bill. And I was like, okay, this girl wrote a bill. And I was like, okay, find yourself a sponsor. She's like, working on it. I have a coffee date with the Secretary of State of Montana. And I was like, I've never even talked to the Secretary of State of Montana. Like, she has a coffee date with her. Okay, this is pretty amazing. So the next thing she knows is she's got a sponsor. And now I'm like, okay, now we'll open up the doors. So then we were in business and labor for a PTA supervision bill. So they were seeing us. So when we finally came at them with the Medicaid bill, they knew who we were. Sure. They knew our faces, and they knew what problems we were trying to solve. And our first 2 bills cost them nothing.
Yeah, they didn't have a fiscal note. This is the bill that cost us a fiscal note. But when we came in with the numbers, they knew us, they respected us, and they were ready to have a conversation. So
it's a relationship bill.
It is.
So, Athelis Revenue Cycle Management gives you full visibility to your money, real-time dashboards, automated billing, and higher collections. No more guessing what's coming in. Shoot me a note, and I'll get you connected today. Jimmy@ptpintcast.com. What advice would you give for someone who, you know what? No, let me ask this question better. What advice would you have given to your former selves 5 years ago before you started this? Is it what I want to do is have someone listening now say, well, these 2 did it. Why not me? Why am I not? I'm qualified, right? And I want change. And so what advice would you give?
I would say keep asking a lot of questions and being curious about everything. And don't be afraid to step into that space. And don't be afraid to fail in that space, because we've failed a lot in this space. We've been told, I don't know how many times, and that's okay. We come at it a different angle. Continue to be curious, continue to ask lots of questions, continue to understand the problem that is there, and step forward and know that you may fail and fall on your face, but you can create this group of people that really like brings you up and holds you together and is ready to catch you when you stumble. So, and don't be afraid. There we go. That's a lot.
I agree with all of that. And I would say, as you do that, make sure you have your Emily. You have to have fun. Like, life is too short. And like, we have like over 3,500 miles that she and I drove back and forth from. I mean, Montana's a big state, so we had a lot of car time.
Yeah.
But we also had people that were driving all over from the state, and we'd meet in Helena, and we had Zooms, and we created a community of people that were really engaged. But we also had fun, and our lobbyist is so fun. We, sending him back to, just checking in on other things, and just, I think that is really important, is that team. And I'm very driven because, if Emily's daughter's in the hospital, I can be like, I got this. I will take it. Don't worry. Send everything over to me, or whatever. It's just, it was nice to have that, like, not one person. A lot of times one person can make a change, but you can really make an impact if you get that momentum of the community. And I just think that is like starts to sweep other people in. Like, once we started with 5, pretty soon that got to 10. And now we have like 20, 25 people that are really engaged. And we had 38 business owners show up and testify against this, or for this Medicaid bill, which is huge. Like, our lobbyist was like, shut them down. I'm like, floodgates are open. I can't, you told me to have my members show up. He's like, I haven't seen this many people ever testify, and they're all small business owners. I'm like, PTs care.
Yeah. Once we
Good.
gave them the thing. And I mean, that bill is still huge. So we went after that, and it's 20% over Medicare. So the latest update on that bill, Jimmy, though, is it is looking at so it passed through the House officially 85 to 15, 34 to 16 in the Senate. So bipartisan support, over 2/3. And it's likely landing, it's on the governor's desk right now, and it's going to be vetoed, is what we're hearing.
Really?
So, yes. So we have one last chance, is we have the votes, and we're allowed a mail-in veto override. So we will be pursuing that probably starting next week. And that means we're getting all of our members and all of our PT people, all of them across the state. And for the first time ever, our lobbyists has let us bring in public to slam every legislator to say, you voted for this once, I need you to vote it for again. As long as we have every single legislator that voted yes the first time, we will override this. But they've got to be comfortable with it.
And then there'll be a party to celebrate when you're done.
Yes, there will be a huge party with a lot of us to celebrate when we're done.
So we'll pass along the result once we find it.
Yeah.
We'll let you know.
It's gonna it's fun. It's like the fight isn't quite over, and it's in some ways like the athlete in me is kind of like, yeah, we're going into overtime, let's do this.
I'm like, I wanted it to be done before overtime. Yeah. I do not need a sudden death. Golden goal
make such
hockey.
A good story potentially.
No, I wanted it done, but here we are, still there.
We also we joined the Montana State Chamber, so we've had, I would say the other piece there is, along with the community, is really just start to network with we attended all the work conferences 2-3 years prior to this legislation, and just relationships again, and just talking to the other stakeholders. And when this bill, we found out that it's most likely going to be vetoed, I called some folks at the chamber, and they're like, oh, north, basically the rural end of the state where there's more cows than people, and it's all radio. And she's like, we can get a PT being interviewed there, and it will go to every small town on this broadcaster's, radio station about this bill next week. So we're going to press, we're going to have moms and dads telling stories of kiddos not going to be able to continue care. And, we're going to throw everything we have at it. So it'll be fun.
Great. You learned a lot, right?
Learned tons.
Love it.
It's amazing how much we learn. I love that Jenda, which was our lead for our PTA supervision bill, and she took that whole lead. She's like, yeah, I actually had to go video schoolhouse, how a bill is made again, because I totally forgot. And when she goes, once it got through the House, she goes, I thought it was done. I turned to her, I go, no, we got to go do this in the Senate now. She's like, what? I go do it all over again. And she's like, oh. Yeah. Okay, we'll be here again. So it's
if you have a fiscal note, it's 8 or 9 different hoops. But
we all learned lots. We learned about a lot of each other, a lot about our clinics around the state. We have new leaders emerging because it gave them an opportunity to have a seat at the table that they didn't know they could make change, which is even more fun, in my opinion, is just getting more people to understand the value of what we're doing and what we're trying to do, and get people behind us to take the lead when we're done in our roles in the future. So,
and I will say, I was stepped away from clinic care. Emily was still doing a lot of clinic care, but had her magic happening. She, had a lot of different folks being able to cover, but it took a hit. My business partners were all in, let's get this done. You got the momentum. Let's just do this. But that came at a huge cost, right? You were driving to Helena every week and calling and all these meetings and all the things. So it does take a lot of time, and someone has to do that. And some business that can do it for our profession, or some business owner that can do it, needs to figure that out too. And I think also at the same time, others need to recognize that too, that it was a sacrifice, but that's part of it, right? Nothing comes easy that's worthwhile. So
last thing we do on the show, your mic drop moment. What's your parting shot? You each get one. What's the last thing you'd want the audience to remember as we wrap up?
Because I would say for me is be curious, ask lots of questions. The more you understand the problem and the better you are at finding those solutions. That would be my big one.
I am really adamant that PTs need to step into our scope. We have so much to bring to our profession and to the healthcare system, and we need to stop being so passive. We need to doctor up and quit with being watered down and doing volume-based care and get rid of the techs and demand that we have licensed professionals and embrace the PTAs. They could be such a piece to our profession. We will never get paid what we're deserved if we have people that are working underneath us that are unlicensed and unskilled. So I just think that we need to acknowledge that, and there needs to be a change out there for that.
Great. Hey, thanks so much for doing all that work, and thanks for sharing so other people maybe can take up that work either in Montana or wherever they are in the profession. So thank you.
Thank you.
Yeah.
Like what you heard? Great. Subscribe to the show on Apple or Spotify. You can watch the episodes on YouTube. Or don't. I'm not your boss. You want to specialize in ortho, neuro, or sports physical therapy and actually get paid while doing it? Brooks IHL offers accredited residencies and fellowships with full salary, full benefits, and real mentorship from clinical experts. Learn more and apply at brooksihl.org. There aren't nearly enough podcasts in this world. Said no one. Why not launch one more? If you thought about launching a show but don't quite know how, we can help you do all that back-end stuff. Email me at jimmy@ptpintcast.com, and we can add one more podcast no one else will listen to the pile.